I'm going to administer a medication by the 6 rights. Right patient, right dose, right time, right route, right medication, and right documentation. The first thing I'm going to do is make sure that I have my correct patient identifiers. I'm going to ask him to state his name and date of birth and check his wristband. And then I'm going to go ahead and wash my hands. And I'm going to check the MAR. And the MAR states to give Dilaudid 2 milligrams every 2 hours is needed for complaint of pain related to coughing. Dilaudid label states each milligram administered to be diluted with 2 mils normal saline. Give Dilaudid 1 milligram every 2 minutes. So what I'm going to do is I'm going to break this down to a saline lock. So I'm going to just wash my hands. Okay, so I'm going to go ahead and just put gloves on. Okay, so I'm going to make sure that this is clamped closed all the way. And this was my 2nd liter of 1,000 mils normal saline, so that is why. Okay, and then I'm going to go ahead and carefully and then I need to clean this, but first I'm going to go ahead and get my medication going. So I need to do, it's asking for 2 milligrams, but I need to have it diluted with 2 mils normal saline. So I'm going to draw up 2 milligrams of Dilaudid. I'm going to make sure that this is clean. I'm going to make sure that this one is clean as well. Okay. So I'm going to go ahead and draw up 2 mils of Dilaudid. Okay, and then I'm going to dilute those 2 mils with normal saline. So I'm just gonna, okay. So now I have 4 milligrams of solution, which equals 2 milligrams of Dilaudid diluted with 2 milligrams of normal saline. That's on a sterile thing, so I'm going to go ahead and recap this. Okay, and I'm going to put this in the sharps container. I'm going to set that on a sterile thing. Okay, the next thing I'm going to do is I'm going to alcohol my hub to make sure that it is clean and sterile. And then once that dries, I'm going to push 5 mils of normal saline. I'm going to do a drawback to see if there's any. Okay, so I'm going to go ahead and push 5 mils. Okay, I'm going to set this on the sterile. Then I'm going to take my Dilaudid, and I need to push my Dilaudid 1 milligram every 2 minutes. And since there's 2 milligrams of Dilaudid, I'm going to push it through within 4 minutes. So I'm going to do this very slowly, and I'm going to push it within 4 minutes. My 4 minutes are up. Okay. I'm going to go ahead and push that with 5 mils of normal saline. I'm just going to push the 5 mils. Okay. And the next thing I'm going to do is I'm going to reassess my patient's pain level. And then I'm going to teach him that to make sure that he doesn't bump the hub. If he sees any phlebitis or any irritation, redness, bleeding, to let me know. I'm then going to go ahead and lower my patient and give him his call light and make sure that he's okay. I'm going to dispose of my stuff properly and wash my hands. And then I'm going to do all the documentation in the computer. So once that's all done, I'm going to look at my order and it's going to ask me to discontinue the IV. So now I'm going to discontinue the IV. I'm going to come into the patient's room, wash my hands, make sure I have the right patient. I'm going to go ahead and just make sure that everything still looks good. All right, make sure that's open. And I want to just kind of peel this all to the middle. Carefully, because I don't want to make my patient uncomfortable. Could be a bugger. Make sure everything's stable. I think it's gold taper. I'm doing this very gentle and it's easier coming up. Okay. Oh my goodness. All right. Okay. In normal situation, it would not be this difficult. Okay. Once I have everything brought to the middle, I'm going to go ahead and set my little 2x2 sterile gauze on there, and I'm going to remove that catheter. I'm going to inspect my catheter for any damage or bending in the wrong place, anything like that. It looks good. I'm actually going to take the catheter and put it in the sharps container. And then I'm going to go ahead and just kind of hold a little bit of pressure and apply tape. And then assess my patient, ask them if they're okay, have them make sure to watch for any bleeding, bruising, pain, anything like that. I'm going to make sure that they're comfortable. I'm going to dispose of my gloves, wash my hands, give my patient their call light, tell them just to call me if anything, and then document all of my procedures here. And then my IV is now discontinued.